BPSC BPS 17, Medical Officer and Lady Medical Officer. Paper 5. 100 most repeated questions taken from authentic past papers. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. Von Willebrand disease is characterized by Option A. Isolated factor 9 deficiency. Option B. Low platelet count. Option C. Short bleeding time. Option D. Prolonged bleeding time with normal platelet count. The correct answer is option D. Prolonged bleeding time with normal platelet count. Let's go through the options. Isolated factor 9 deficiency. Factor 9 deficiency is hemophilia B. Low platelet count. The platelet count is normal in classic von Willebrand disease. Short bleeding time. The bleeding time is prolonged, not short. And the correct answer is prolonged bleeding time with normal platelet count. Von Willebrand disease gives a prolonged bleeding time with a normal platelet count. So, the right answer is option D. Prolonged bleeding time with normal platelet count. Question 2. Hemophilia A results from deficiency of Option A. Factor 7. Option B. Factor 9. Option C. Factor 8. Option D. Factor 11. The correct answer is option C. Factor 8. Let's go through the options. Factor 7. Factor 7 deficiency is a separate rare disorder. Factor 9. Factor 9 deficiency is hemophilia B. Factor 11. Factor 11 deficiency is hemophilia C. And the correct answer is factor 8. Hemophilia A is a deficiency of factor 8. So, the right answer is option C. Factor 8. Question 3. In hemophilia, the factor level required to cover surgery is about Option A. 50 to 70%. Option B. 10%. Option C. 20%. Option D. 90%. The correct answer is option A. 50 to 70%. Let's go through the options. 10%. 10% is too low. 20%. 20% is inadequate for surgery. 90%. 90 is more than needed. And the correct answer is 50 to 70%. About 50 to 70% factor level is needed to cover surgery. So, the right answer is option A. 50 to 70%. Question 4. Thrombotic thrombocytopenic purpura is treated with Option A. Aspirin. Option B. Platelet transfusion. Option C. Plasma exchange. Option D. Heparin. The correct answer is option C. Plasma exchange. Let's go through the options. Aspirin. Aspirin is not the treatment. Platelet transfusion. Platelet transfusion can worsen it. Heparin. Heparin is not indicated. And the correct answer is plasma exchange. Plasma exchange is the treatment for thrombotic thrombocytopenic purpura. So, the right answer is option C. Plasma exchange. Question 5. Disseminated intravascular coagulation is not typically related to Option A. Obstetric hemorrhage. Option B. Sepsis. Option C. Thrombolytic therapy. Option D. Malignancy. The correct answer is option C, thrombolytic therapy. Let's go through the options. Obstetric hemorrhage. Obstetric hemorrhage causes disseminated intravascular coagulation. Sepsis. Sepsis causes it. Malignancy. Malignancy causes it. And the correct answer is thrombolytic therapy. Thrombolytic therapy is not a typical cause, so it is the exception. So, the right answer is option C. Thrombolytic therapy. Question 6. The first serological marker to appear in hepatitis B is option A, HBsAg. Option B, anti-HBs. Option C, anti-HBc-IgG. Option D, BEAG. The correct answer is option A, HBsAg. Let's go through the options. Anti-HBs. Anti-HBs appears during recovery. Anti-HBc-IgG. Anti-HBc-IgG is a late marker. BEAG. BEAG appears after the surface antigen. And the correct answer is HBsAg. The surface antigen, HBsAg, is the first marker to appear. So, the right answer is option A. HBsAg. Question 7. Hepatitis B virus is A. Option A, single-stranded RNA virus. Option B, DNA virus. Option C, retrovirus. Option D, double-stranded RNA virus. The correct answer is option B, DNA virus. Let's go through the options. Single-stranded RNA virus. It is not a single-stranded Rana virus. Retrovirus. It is not a classic retrovirus. Double-stranded RNA virus. It is not a double-stranded Rana virus. And the correct answer is DNA virus. Hepatitis B is a DNA virus. So, the right answer is option B. DNA virus. Question 8. Adenovirus is A. Option A, RNA virus. Option B, DNA virus. Option C, retrovirus. Option D, prion. The correct answer is option B, DNA virus. Let's go through the options. RNA virus. It is not an Rana virus. Retrovirus. Not a retrovirus. Prion. Not a prion. And the correct answer is DNA virus. Adenovirus is a DNA virus. So, the right answer is option B. DNA virus. Question 9. The incubation period of hepatitis B is about option A, 1 to 6 months. Option B, 1 week. Option C, 10 days. Option D, 2 years. The correct answer is option A, 1 to 6 months. Let's go through the options. 1 week. 1 week is too short. 10 days. 10 days is too short. 2 years. 2 years is too long. And the correct answer is 1 to 6 months. The incubation is about 1 to 6 months. So, the right answer is option A. 1 to 6 months. Question 10. In hepatitis C, the response to therapy is best predicted by the option A, liver biopsy. Option B, viral load alone. Option C, genotype. Option D, alt level. The correct answer is option C, genotype. Let's go through the options. Liver biopsy. A biopsy shows damage, not the response. Viral load alone. Viral load alone is not the best predictor. Alt level. The alt reflects inflammation. And the correct answer is genotype. The genotype best predicts the response to therapy. So, the right answer is option C. Genotype. Question 11. Buddhachari syndrome results from obstruction of the option A. Splenic vein, option B. Portal vein, option C. Hepatic veins, option D. Hepatic artery. The correct answer is option C. Hepatic veins. Let's go through the options. Splenic vein. The splenic vein is not it. Portal vein. The portal vein gives portal hypertension. Hepatic artery. The hepatic artery is not it. And the correct answer is hepatic veins. Buddhachari syndrome is hepatic vein obstruction. So, the right answer is option C. Hepatic veins. Question 12. Lean neck cirrhosis is due to option A. Wilson disease, option B. Hepatitis B, option C. Hemochromatosis, option D. Alcoholism. The correct answer is option D. Alcoholism. Let's go through the options. Wilson disease. Wilson disease is a copper disorder. Hepatitis B. Hepatitis B is viral. Hemochromatosis. Hemochromatosis is iron overload. And the correct answer is alcoholism. Lean neck cirrhosis is due to alcoholism. So, the right answer is option D. Alcoholism. Question 13. A radiolucent renal stone is most likely composed of option A. Calcium phosphate, option B. Calcium oxalate, option C. Uric acid, option D. Struvite. The correct answer is option C. Uric acid. Let's go through the options. Calcium phosphate. Calcium phosphate is radiopaque. Calcium oxalate. Calcium oxalate is radiopaque. Struvite. Struvite is radiopaque. And the correct answer is uric acid. Uric acid stones are radiolucent. So, the right answer is option C. Uric acid. Question 14. The commonest type of renal stone is option A. Cystine, option B. Uric acid, option C. Calcium oxalate, option D. Struvite. The correct answer is option C. Calcium oxalate. Let's go through the options. Cystine. Cystine stones are rare. Uric acid. Uric acid is less common. Struvite. Struvite is less common. And the correct answer is calcium oxalate. Calcium oxalate is the commonest renal stone. So, the right answer is option C. Calcium oxalate. Question 15. Microalbuminuria is defined as urinary albumin of option A. 30 to 300 mg per 24 hours. Option B. Less than 10 mg per 24 hours. Option C. 500 to 800 mg per 24 hours. Option D. More than 1 gram per 24 hours. The correct answer is option A. 30 to 300 mg per 24 hours. Let's go through the options. Less than 10 milligrams per 24 hours. Less than 10 is normal. 500 to 800 milligrams per 24 hours. 500 to 800 is macroalbuminuria. More than 1 gram per 24 hours. Over 1 gram is heavy proteinuria. And the correct answer is 30 to 300 milligrams per 24 hours. 30 to 300 milligrams per day defines microalbuminuria. So, the right answer is option A. 30 to 300 milligrams per 24 hours. Question 16. Serum magnesium is characteristically increased in option A. Cardiac failure. Option B. Liver failure. Option C. Renal failure. Option D. Respiratory failure. The correct answer is option C. Renal failure. Let's go through the options. Cardiac failure. Cardiac failure does not raise it. Liver failure. Liver failure does not. Respiratory failure. Respiratory failure does not. And the correct answer is renal failure. Renal failure raises the serum magnesium. So, the right answer is option C. Renal failure. Question 17. Pure red cell aplasia is associated with option A. Raised erythropoietin level. Option B. Low erythropoietin. Option C. Raised reticulocytes. Option D. Leukocytosis. The correct answer is option A. Raised erythropoietin level. Let's go through the options. Low erythropoietin. It is not low. Raised reticulocytes. Reticulocytes are low, not raised. Leukocytosis. There is no leukocytosis. And the correct answer is raised erythropoietin level. Erythropoietin is high because red cells are absent. So, the right answer is option A. Raised erythropoietin level. Question 18. Eosinophilia is characteristically not seen in option A. Asthma. Option B. Typhus. Option C. Parasitic infestation. Option D. Drug reaction. The correct answer is option B. Typhus. Let's go through the options. Asthma. Asthma raises eosinophils. Parasitic infestation. Parasites raise them. Drug reaction. Drug reactions raise them. And the correct answer is typhus. Typhus, a bacterial infection, does not raise eosinophils, the exception. So, the right answer is option B. Typhus. Question 19. Listeria monocytogenes characteristically causes option A. Pneumonia. Option B. Meningitis. Option C. Cystitis. Option D. Endocarditis. The correct answer is option B. Meningitis. Let's go through the options. Pneumonia. Pneumonia is not typical. Cystitis. Cystitis is not typical. Endocarditis. Endocarditis is uncommon. And the correct answer is meningitis. Listeria causes meningitis, especially in neonates and the immunosuppressed. So, the right answer is option B. Meningitis. Question 20. Klebsiella is a classic cause of which pneumonia? Option A. Lobar pneumonia. Option B. Atypical pneumonia. Option C. Aspiration pneumonia only. Option D. Viral pneumonia. The correct answer is option A, lobar pneumonia. Let's go through the options. Atypical pneumonia. It is not atypical. Aspiration pneumonia only. Aspiration is a different setting. Viral pneumonia. It is not viral. And the correct answer is lobar pneumonia. Klebsiella causes a severe lobar pneumonia with recurrent sputum. So, the right answer is option A. Lobar pneumonia. Question 21. A hypertrophic scar characteristically. Option A regresses after about 6 months. Option B extends beyond the wound. Option C never regresses. Option D becomes malignant. The correct answer is option A, regresses after about 6 months. Let's go through the options. Extends beyond the wound. It stays within the wound, unlike a keloid which extends beyond. Never regresses. It does regress. Becomes malignant. It does not become malignant. And the correct answer is regresses after about 6 months. A hypertrophic scar regresses after about 6 months. So, the right answer is option A. Regresses after about 6 months. Question 22. The best site for an intramuscular injection is the option A, anterior thigh only. Option B, inner upper quadrant. Option C, lower outer quadrant. Option D, outer upper quadrant of the buttock. The correct answer is option D, outer upper quadrant of the buttock. Let's go through the options. Anterior thigh only. The anterior thigh is used but not the classic buttock site. Inner upper quadrant. The inner upper quadrant risks the nerve. Lower outer quadrant. The lower outer quadrant is not safe. And the correct answer is outer upper quadrant of the buttock. The outer upper quadrant of the buttock is safe, away from the sciatic nerve. So, the right answer is option D. Outer upper quadrant of the buttock. Question 23. Healing by first intention means. Option A, union between two clean opposed edges. Option B, healing by granulation. Option C, healing with infection. Option D, healing with a scar only. The correct answer is option A, union between two clean opposed edges. Let's go through the options. Healing by granulation. Granulation is second intention. Healing with infection. Infection delays healing. Healing with a scar only. A scar alone is not the definition. And the correct answer is union between two clean opposed edges. Healing by first intention is union of two clean opposed edges. So, the right answer is option A. Union between two clean opposed edges. Question 24. Delayed primary suture is performed. Option A, 4 to 6 days after wound surgery once edema subsides. Option B, immediately. Option C, after 3 weeks. Option D, after 3 months. The correct answer is option A, 4 to 6 days after wound surgery once edema subsides. Let's go through the options. Immediately. Immediate closure is primary suture. After 3 weeks. 3 weeks is secondary suture. After 3 months. 3 months is too late. And the correct answer is 4 to 6 days after wound surgery once edema subsides. Delayed primary suture is done 4 to 6 days later, once oedema and contamination settle. So, the right answer is option A. 4 to 6 days after wound surgery once oedema subsides. Question 25. The extent of tissue damage from a bullet depends principally on its option A. Weight, option B. Velocity, option C. Caliber, option D. Shape. The correct answer is option B. Velocity. Let's go through the options. Weight. Weight matters less. Caliber. Caliber is secondary. Shape. Shape is secondary. And the correct answer is velocity. Kinetic energy rises with the square of velocity, so velocity is the main factor. So, the right answer is option B. Velocity. Question 26. A decubitus ulcer is option A. An arterial ulcer, option B. A venous ulcer, option C. A pressure sore, option D. A neuropathic ulcer. The correct answer is option C. A pressure sore. Let's go through the options. An arterial ulcer. It is not arterial. A venous ulcer. Not venous. A neuropathic ulcer. Not neuropathic. And the correct answer is a pressure sore. A decubitus ulcer is a pressure sore. So, the right answer is option C. A pressure sore. Question 27. Cellulitis is most commonly caused by option A. Streptococcus pyogenes, option B. Staphylococcus epidermidis, option C. E. coli, option D. Pseudomonas. The correct answer is option A. Streptococcus pyogenes. Let's go through the options. Staphylococcus epidermidis. Staphylococcus epidermidis is a skin commensal. E. coli. E. coli is a gut organism. Pseudomonas. Pseudomonas is less common. And the correct answer is Streptococcus pyogenes. Streptococcus pyogenes is the commonest cause of cellulitis. So, the right answer is option A. Streptococcus pyogenes. Question 28. Split thickness skin graft thickness is about option A. 0.3 to 0.5 millimeters. Option B. 0.05 millimeters. Option C. 1 to 2 millimeters. Option D. 3 millimeters. The correct answer is option A. 0.3 to 0.5 millimeters. Let's go through the options. 0.05 millimeters. 0.05 is too thin. 1 to 2 millimeters. 1 to 2 millimeters is full thickness. 3 millimeters. 3 is too thick. And the correct answer is 0.3 to 0.5 millimeters. A split thickness graft is about 0.3 to 0.5 millimeters. So, the right answer is option A. 0.3 to 0.5 millimeters. Question 29. A dermatome is used to option A. Measure sensation. Option B. Excise a tumor. Option C. Harvest a skin graft. Option D. Drain an abscess. The correct answer is option C. Harvest a skin graft. Let's go through the options. Measure sensation. It does not measure sensation. Excise a tumor. It is not for excision. Drain an abscess. It does not drain abscesses. And the correct answer is harvest a skin graft. A dermatome harvests a skin graft. So, the right answer is option C. Harvest a skin graft. Question 30. Wide scars typically result from option A. Deep sutures. Option B. Use of subcutaneous absorbable sutures. Option C. Early removal of sutures. Option D. Interrupted sutures. The correct answer is option B. Use of subcutaneous absorbable sutures. Let's go through the options. Deep sutures. Deep sutures are not the cause. Early removal of sutures. Early removal is desirable. Interrupted sutures. Interrupted sutures are fine. And the correct answer is use of subcutaneous absorbable sutures. Subcutaneous absorbable sutures left long give wide scars. So, the right answer is option B. Use of subcutaneous absorbable sutures. Question 31. In burns, the fluid used for resuscitation contains option A. Dextrose only. Option B. Plasma and albumin. Option C. Normal saline only. Option D. Blood only. The correct answer is option B. Plasma and albumin. Let's go through the options. Dextrose only. Dextrose alone does not resuscitate. Normal saline only. Saline alone is not the key answer. Blood only. Blood alone is not first line. And the correct answer is plasma and albumin. Colloid, plasma and albumin is used in burns resuscitation. So, the right answer is option B. Plasma and albumin. Question 32. In an emergency, a tracheostomy incision is made. Option A. Horizontally. Option B. Vertically. Option C. Obliquely. Option D. Longitudinally. The correct answer is option A. Horizontally. Let's go through the options. Vertically. A vertical incision is for elective cases. Obliquely. Oblique is not standard. Longitudinally. Longitudinal is not standard. And the correct answer is horizontally. An emergency tracheostomy uses a horizontal incision for speed. So, the right answer is option A. Horizontally. Question 33. Preeclampsia is defined by the presence of option A. Oedema alone. Option B. Hypertension, proteinuria and non-dependent oedema. Option C. Hypertension alone. Option D. Proteinuria alone. The correct answer is option B. Hypertension, proteinuria and non-dependent oedema. Let's go through the options. Oedema alone. Oedema alone is not enough. Hypertension alone. Hypertension alone is not it. Proteinuria alone. Proteinuria alone is not it. And the correct answer is hypertension, proteinuria and non-dependent oedema. Preeclampsia is hypertension with proteinuria and non-dependent oedema. So, the right answer is option B. Hypertension, proteinuria and non-dependent oedema. Question 34. Oxytocin is contraindicated in option A. Postpartum hemorrhage. Option B. Prolonged labor. Option C. Abnormal fetal presentation. Option D. Induction at term. The correct answer is option C, abnormal fetal presentation. Let's go through the options. Postpartum hemorrhage. It treats postpartum hemorrhage. Prolonged labor. It is used in prolonged labor. Induction at term. It is used to induce at term. And the correct answer is abnormal fetal presentation. Oxytocin is contraindicated with an abnormal fetal presentation, risking rupture. So, the right answer is option C. Abnormal fetal presentation. Question 35. Adverse effects of oxytocin include all except option A, uterine hyperstimulation. Option B, water intoxication. Option C, hypertension. Option D, fetal distress. The correct answer is option C, hypertension. Let's go through the options. Uterine hyperstimulation. Hyperstimulation is an effect. Water intoxication. Water intoxication is an effect. Fetal distress. Fetal distress can occur. And the correct answer is hypertension. Hypertension is not a typical oxytocin effect, the exception. So, the right answer is option C. Hypertension. Question 36. Estrogen replacement therapy increases the risk of option A, colonic cancer. Option B, osteoporosis. Option C, coronary heart disease. Option D, anemia. The correct answer is option C, coronary heart disease. Let's go through the options. Colonic cancer. It protects against colon cancer. Osteoporosis. It protects against osteoporosis. Anemia. It does not cause anemia. And the correct answer is coronary heart disease. The key marks coronary heart disease as an increased risk. So, the right answer is option C. Coronary heart disease. Question 37. Combined oral contraceptives are protective against option A, breast cancer. Option B, ovarian and endometrial cancer. Option C, cervical cancer. Option D, liver adenoma. The correct answer is option B, ovarian and endometrial cancer. Let's go through the options. Breast cancer. It slightly raises breast cancer risk. Cervical cancer. Not cervical cancer. Liver adenoma. It can cause a liver adenoma. And the correct answer is ovarian and endometrial cancer. The combined pill protects against ovarian and endometrial cancer. So, the right answer is option B. Ovarian and endometrial cancer. Question 38. In couple infertility, which investigation is not routinely done? Option A, semen analysis. Option B, maternal and paternal karyotyping. Option C, hysterosalpingography. Option D, ovulation studies. The correct answer is option B, maternal and paternal karyotyping. Let's go through the options. Semen analysis. Semen analysis is routine. Hysterosalpingography. Hysterosalpingography is routine. Ovulation studies. Ovulation studies are routine. And the correct answer is maternal and paternal karyotyping. Karyotyping is not routine, the exception. So, the right answer is option B. Maternal and paternal karyotyping. Question 39. Habitual abortion is investigated by option A, basal body temperature. Option B. Pelvic ultrasound. Option C. Skin biopsy. Option D. Bone scan. The correct answer is option B. Pelvic ultrasound. Let's go through the options. Basal body temperature. Basal temperature is of limited value. Skin biopsy. A skin biopsy is irrelevant. Bone scan. A bone scan is irrelevant. And the correct answer is pelvic ultrasound. Pelvic ultrasound assesses the uterus for causes of recurrent abortion. So, the right answer is option B. Pelvic ultrasound. Question 40. Forceps used in obstructed labor are: Option A. Neville Barnes forceps. Option B. Ridley forceps. Option C. Simpson forceps. Option D. Keeland forceps. The correct answer is option D. Keeland forceps. Let's go through the options. Neville Barnes forceps. Neville Barnes are outlet forceps. Ridley forceps. Ridley are outlet forceps. Simpson forceps. Simpson are traction forceps. And the correct answer is Keeland forceps. Keeland forceps with a sliding lock are the rotational forceps referenced here. So, the right answer is option D. Keeland forceps. Question 41. In pregnancy, anemia is characteristically associated with: Option A. Reduced red cell mass only. Option B. Reduced plasma volume. Option C. Increased hematocrit. Option D. Increased plasma volume. The correct answer is option D. Increased plasma volume. Let's go through the options. Reduced red cell mass only. Red cell mass actually rises. Reduced plasma volume. Plasma volume rises, not falls. Increased hematocrit. The hematocrit falls. And the correct answer is increased plasma volume. The plasma volume rises more than the red cell mass, giving a dilutional anemia. So, the right answer is option D. Increased plasma volume. Question 42. Bleeding at 10 weeks with an open cervical OS indicates: Option A. Threatened abortion. Option B. Inevitable abortion. Option C. Missed abortion. Option D. Complete abortion. The correct answer is option B. Inevitable abortion. Let's go through the options. Threatened abortion. Threatened abortion has a closed OS. Missed abortion. Missed abortion has a closed OS. Complete abortion. Complete abortion has passed everything. And the correct answer is inevitable abortion. An open OS means an inevitable abortion. So, the right answer is option B. Inevitable abortion. Question 43. The least common complication of a fibroid uterus is: Option A. Malignant change. Option B. Menorrhagia. Option C. Pressure symptoms. Option D. Infertility. The correct answer is option A. Malignant change. Let's go through the options. Menorrhagia. Menorrhagia is common. Pressure symptoms. Pressure symptoms are common. Infertility. Infertility can occur. And the correct answer is malignant change. Malignant change is the least common complication of a fibroid. So, the right answer is option A. Malignant change. Question 44. Carcinoma of the body of the uterus is usually A. Option A. Adenocarcinoma. Option B. Squamous carcinoma. Option C. Sarcoma. Option D. Small cell carcinoma. The correct answer is option A. Adenocarcinoma. Let's go through the options. Squamous carcinoma. Squamous carcinoma is cervical. Sarcoma. Sarcoma is rare. Small cell carcinoma. Small cell is rare. And the correct answer is adenocarcinoma. Carcinoma of the uterine body is usually an adenocarcinoma. So, the right answer is option A. Adenocarcinoma. Question 45. Achondroplasia is inherited as option A. X-linked dominant. Option B. Autosomal recessive. Option C. X-linked recessive. Option D. Autosomal dominant. The correct answer is option D. Autosomal dominant. Let's go through the options. X-linked dominant. It is not X-linked dominant. Autosomal recessive. Not autosomal recessive. X-linked recessive. Not X-linked recessive. And the correct answer is autosomal dominant. Achondroplasia is autosomal dominant. So, the right answer is option D. Autosomal dominant. Question 46. Retinoblastoma has an inheritance risk of about option A. More than 85% in the hereditary form. Option B. 5%. Option C. 25%. Option D. 50% in all cases. The correct answer is option A. More than 85% in the hereditary form. Let's go through the options. 5%. 5% understates it. 25%. 25 is not correct. 50% in all cases. Not 50% in all cases. And the correct answer is more than 85% in the hereditary form. The hereditary form carries a high, over 85% transmission risk. So, the right answer is option A. More than 85% in the hereditary form. Question 47. The cremasteric reflex is characteristically absent in the option A. Adolescent. Option B. Toddler. Option C. School child. Option D. Newborn. The correct answer is option D. Newborn. Let's go through the options. Adolescent. The adolescent has the reflex. Toddler. The toddler has it. School child. The school child has it. And the correct answer is newborn. The cremasteric reflex is absent in the newborn. So, the right answer is option D. Newborn. Question 48. Phenylketonuria is a contraindication to option A. Vitamin D. Option B. Immunization. Option C. Breastfeeding. Option D. Iron therapy. The correct answer is option C. Breastfeeding. Let's go through the options. Vitamin D. Vitamin D is fine. Immunization. Immunization is fine. Iron therapy. Iron is fine. And the correct answer is breastfeeding. Breastfeeding is restricted in phenylketonuria, needing a special low phenylalanine formula. So, the right answer is option C. Breastfeeding. Question 49. Go-where sign is characteristic of Option A. Poliomyelitis. Option B. Cerebral palsy. Option C. Duchenne muscular dystrophy. Option D. Spina bifida. The correct answer is option C. Duchenne muscular dystrophy. Let's go through the options. Poliomyelitis. Not poliomyelitis. Cerebral palsy. Not cerebral palsy. Spina bifida. Not spina bifida. And the correct answer is Duchenne muscular dystrophy. The go-where sign, climbing up the legs to stand, is seen in Duchenne muscular dystrophy. So, the right answer is option C. Duchenne muscular dystrophy. Question 50. Hirschsprung disease is best diagnosed by Option A. Barium enema alone. Option B. Rectal biopsy. Option C. Ultrasound. Option D. Manometry alone. The correct answer is option B. Rectal biopsy. Let's go through the options. Barium enema alone. A barium enema alone is only suggestive. Ultrasound. Ultrasound is not diagnostic. Manometry alone. Manometry alone is not. And the correct answer is rectal biopsy. Rectal biopsy showing absent ganglion cells is diagnostic of Hirschsprung disease. So, the right answer is option B. Rectal biopsy. Question 51. A ganglionic segment in Hirschsprung disease shows raised. Option A. Lipase. Option B. Alkaline phosphatase. Option C. Amylase. Option D. Acetylcholinesterase activity. The correct answer is option D. Acetylcholinesterase activity. Let's go through the options. Lipase. Lipase is unrelated. Alkaline phosphatase. Alkaline phosphatase is unrelated. Amylase. Amylase is unrelated. And the correct answer is acetylcholinesterase activity. The aganglionic segment shows raised acetylcholinesterase activity. So, the right answer is option D. Acetylcholinesterase activity. Question 52. Nephroblastoma is also known as Option A. Neuroblastoma. Option B. Wilms tumor. Option C. Hepatoblastoma. Option D. Teratoma. The correct answer is option B. Wilms tumor. Let's go through the options. Neuroblastoma. Neuroblastoma is adrenal. Hepatoblastoma. Hepatoblastoma is a liver tumor. Teratoma. A teratoma is different. And the correct answer is Wilms tumor. Nephroblastoma is Wilms tumor. So, the right answer is option B. Wilms tumor. Question 53. Intussusception in children is most commonly Option A. Ileal. Option B. Colocolic. Option C. Jejunal. Option D. Ileocolic. The correct answer is option D. Ileocolic. Let's go through the options. Ileal. Ileal is less common. Colocolic. Colocolic is uncommon. Jejunal. Jejunal is uncommon. And the correct answer is ileocolic. Ileocolic is the commonest type of intussusception in children. So, the right answer is option D. Ileocolic. Question 54. The eustachian tube in children is option A, longer and narrower. Option B, shorter, wider and more horizontal. Option C, more vertical. Option D, absent. The correct answer is option B, shorter, wider and more horizontal. Let's go through the options. Longer and narrower. It is not longer and narrower. More vertical. It is not more vertical. Absent. It is not absent. And the correct answer is shorter, wider and more horizontal. In children it is shorter, wider and more horizontal, so infection spreads. So, the right answer is option B. Shorter, wider and more horizontal. Question 55. Cochlear implant is indicated chiefly in option A, wax impaction. Option B, conductive deafness. Option C, otosclerosis. Option D, postlingual deafness. The correct answer is option D, postlingual deafness. Let's go through the options. Wax impaction. Wax is simply removed. Conductive deafness. Conductive deafness uses hearing aids or surgery. Otosclerosis. Otosclerosis uses stapedectomy. And the correct answer is postlingual deafness. A cochlear implant is chiefly for severe postlingual sensorineural deafness. So, the right answer is option D. Postlingual deafness. Question 56. Schwarz's sign indicates option A, otitis externa. Option B, cholesteatoma. Option C, glomus tumor. Option D, active otosclerosis. The correct answer is option D, active otosclerosis. Let's go through the options. Otitis externa. Not otitis externa. Glomus tumor. Not a glomus tumor. And the correct answer is active otosclerosis. The Schwarz's sign, a pink promontory blush, indicates active otosclerosis. So, the right answer is option D. Active otosclerosis. Question 57. The rising sun sign is characteristic of option A, otosclerosis. Option B, cholesteatoma. Option C, glomus tumor. Option D, acoustic neuroma. The correct answer is option C, glomus tumor. Let's go through the options. Otosclerosis. Not otosclerosis. Cholesteatoma. Not cholesteatoma. Acoustic neuroma. Not acoustic neuroma. And the correct answer is glomus tumor. The rising sun sign, a red mass behind the drum, is a glomus tumor. So, the right answer is option C. Glomus tumor. Question 58. A ranula is treated by option A, aspiration only. Option B, radiotherapy. Option C, marsupialization. Option D, observation. The correct answer is option C, marsupialization. Let's go through the options. Aspiration only. Aspiration recurs. Radiotherapy. Radiotherapy is not used. Observation. Observation does not cure it. And the correct answer is marsupialization. A ranula is treated by marsupialization. So, the right answer is option C. Marsupialization. Question 59. Antrum of Highmore refers to the Option A. Sphenoid sinus. Option B. Frontal sinus. Option C. Ethmoid sinus. Option D. Maxillary sinus. The correct answer is option D. Maxillary sinus. Let's go through the options. Sphenoid sinus. Not the sphenoid sinus. Frontal sinus. Not the frontal sinus. Ethmoid sinus. Not the ethmoid sinus. And the correct answer is maxillary sinus. The antrum of Highmore is the maxillary sinus. So, the right answer is option D. Maxillary sinus. Question 60. Multiple laryngeal papillomatosis is most common in Option A. Elderly men. Option B. Children. Option C. Pregnant women. Option D. Smokers only. The correct answer is option B. Children. Let's go through the options. Elderly men. Not the elderly. Pregnant women. Not pregnant women. Smokers only. Not smokers only. And the correct answer is children. Multiple laryngeal papillomatosis from HPV is commonest in children. So, the right answer is option B. Children. Question 61. A thyroglossal cyst is typically located. Option A. Behind the sternomastoid. Option B. In the posterior triangle. Option C. At or below the hyoid in the midline. Option D. In the submandibular region. The correct answer is option C. At or below the hyoid in the midline. Let's go through the options. Behind the sternomastoid. Not behind the sternomastoid. In the posterior triangle. Not in the posterior triangle. In the submandibular region. Not submandibular. And the correct answer is at or below the hyoid in the midline. A thyroglossal cyst lies at or below the hyoid in the midline and moves with tongue protrusion. So, the right answer is option C. At or below the hyoid in the midline. Question 62. A branchial cyst typically appears at the Option A. Posterior triangle. Option B. Anterior border of sternomastoid, upper third. Option C. Midline. Option D. Supraclavicular fossa. The correct answer is option B. Anterior border of sternomastoid, upper third. Let's go through the options. Posterior triangle. Not the posterior triangle. Midline. Not midline. Supraclavicular fossa. Not the supraclavicular fossa. And the correct answer is anterior border of sternomastoid, upper third. A branchial cyst is at the anterior border of sternomastoid, upper third. So, the right answer is option B. Anterior border of sternomastoid, upper third. Question 63. Aminoglycoside ototoxicity chiefly affects the Option A. External canal. Option B. Middle ear. Option C. Tympanic membrane. Option D. Cochlear and vestibular apparatus. The correct answer is option D. Cochlear and vestibular apparatus. Let's go through the options. External canal. Not the external canal. Middle ear. Not the middle ear. Tympanic membrane. Not the eardrum. And the correct answer is cochlear and vestibular apparatus. Aminoglycosides damage the cochlear and vestibular apparatus. So, the right answer is option D. Cochlear and vestibular apparatus. Question 64. Which vaccine is contraindicated in HIV infection? Option A. Hepatitis B. Option B. BCG. Option C. Tetanus toxoid. Option D. Inactivated polio. The correct answer is option B. BCG. Let's go through the options. Hepatitis B. Hepatitis B vaccine is safe. Tetanus toxoid. Tetanus toxoid is safe. Inactivated polio. Inactivated polio is safe. And the correct answer is BCG. BCG, a live vaccine, is contraindicated in HIV. So, the right answer is option B. BCG. Question 65. Carbimazole in pregnancy is option A. Drug of choice. Option B. Contraindicated. Option C. Safe in all trimesters. Option D. Preferred over propylthiouracil. The correct answer is option B. Contraindicated. Let's go through the options. Drug of choice. It is not first choice. Safe in all trimesters. It is not safe in all trimesters. Preferred over propylthiouracil. It is not preferred over propylthiouracil. And the correct answer is contraindicated. Carbimazole is relatively contraindicated in pregnancy. Propylthiouracil is preferred early. So, the right answer is option B. Contraindicated. Question 66. Graves' disease is managed medically with option A. Propranolol alone. Option B. Levothyroxine. Option C. Prednisolone. Option D. Methimazole. The correct answer is option D. Methimazole. Let's go through the options. Propranolol alone. Propranolol only controls symptoms. Levothyroxine. Levothyroxine is for hypothyroidism. Prednisolone. Prednisolone is not first line. And the correct answer is methimazole. Methimazole, an antithyroid drug, treats Graves' disease. So, the right answer is option D. Methimazole. Question 67. Estrogen in hormone replacement therapy characteristically. Option A. Has no lipid effect. Option B. Decreases HDL. Option C. Increases LDL only. Option D. Increases HDL. The correct answer is option D. Increases HDL. Let's go through the options. Has no lipid effect. It does affect lipids. Decreases HDL. It raises, not lowers, HDL. Increases LDL only. It lowers LDL and raises HDL. And the correct answer is increases HDL. Estrogen increases the HDL cholesterol. So, the right answer is option D. Increases HDL. Question 68. The induction agent of choice in children is option A. Thiopentone. Option B. Sevoflurane. Option C. Ketamine. Option D. Propofol. The correct answer is option B. Sevoflurane. Let's go through the options. Thiopentone. Thiopentone is intravenous. Ketamine. Ketamine is for specific cases. Propofol. Propofol stings on injection. And the correct answer is sevoflurane. Sevoflurane is the inhalational induction agent of choice in children. So, the right answer is option B. Sevoflurane. Question 69. Day case anesthesia most commonly uses. Option A. Propofol. Option B. Thiopentone. Option C. Ether. Option D. Halothane. The correct answer is option A. Propofol. Let's go through the options. Thiopentone. Thiopentone has a hangover effect. Ether. Ether is obsolete. Halothane. Halothane is not preferred. And the correct answer is propofol. Propofol, with rapid recovery, is used for day case anesthesia. So, the right answer is option A. Propofol. Question 70. Which inhaled anesthetic accumulates in air-filled cavities? Option A. Sevoflurane. Option B. Halothane. Option C. Isoflurane. Option D. Nitrous oxide. The correct answer is option D. Nitrous oxide. Let's go through the options. Sevoflurane. Sevoflurane does not. Halothane. Halothane does not. Isoflurane. Isoflurane does not. And the correct answer is nitrous oxide. Nitrous oxide diffuses into and expands air-filled cavities. So, the right answer is option D. Nitrous oxide. Question 71. Pseudomembranous colitis is most classically precipitated by. Option A. Metronidazole. Option B. Penicillin. Option C. Gentamicin. Option D. Clindamycin. The correct answer is option D. Clindamycin. Let's go through the options. Metronidazole. Metronidazole treats it. Penicillin. Penicillin less so. Gentamicin. Gentamicin less so. And the correct answer is clindamycin. Clindamycin is the classic precipitant of pseudomembranous colitis. So, the right answer is option D. Clindamycin. Question 72. Retinoscopy is performed to determine. Option A. Visual field. Option B. Intraocular pressure. Option C. Corneal thickness. Option D. Refractive error. The correct answer is option D. Refractive error. Let's go through the options. Visual field. Not the visual field. Intraocular pressure. Not intraocular pressure. Corneal thickness. Not corneal thickness. And the correct answer is refractive error. Retinoscopy determines the refractive error. So, the right answer is option D. Refractive error. Question 73. Keratometry measures the. Option A. Lens thickness. Option B. Depth of anterior chamber. Option C. Axial length. Option D. Curvature of the cornea. The correct answer is option D. Curvature of the cornea. Let's go through the options. Lens thickness. Not lens thickness. Depth of anterior chamber. Not chamber depth. Axial length. Not axial length. And the correct answer is curvature of the cornea. Keratometry measures the corneal curvature. So, the right answer is option D. Curvature of the cornea. Question 74. The Rinna test compares. Option A 2 years. Option B air conduction with bone conduction. Option C speech with pure tone. Option D loudness only. The correct answer is option B air conduction with bone conduction. Let's go through the options. 2 years. It does not compare the 2 years. Speech with pure tone. Not speech with tone. Loudness only. Not loudness. And the correct answer is air conduction with bone conduction. The Rinna test compares air with bone conduction. So, the right answer is option B. Air conduction with bone conduction. Question 75. Coloboma is a defect of the option A iris. Option B cornea. Option C sclera only. Option D conjunctiva. The correct answer is option A iris. Let's go through the options. Cornea. Not the cornea. Sclera only. Not the sclera alone. Conjunctiva. Not the conjunctiva. And the correct answer is iris. A coloboma is a defect of the iris from failed fissure closure. So, the right answer is option A. Iris. Question 76. Blepharitis is most commonly caused by option A Candida. Option B Streptococcus. Option C Pseudomonas. Option D Staphylococcus aureus. The correct answer is option D Staphylococcus aureus. Let's go through the options. Candida. Not Candida. Streptococcus. Not Streptococcus. Pseudomonas. Not Pseudomonas. And the correct answer is Staphylococcus aureus. Blepharitis is commonly caused by Staphylococcus aureus. So, the right answer is option D. Staphylococcus aureus. Question 77. Mycotic corneal ulcer is most commonly caused by option A Fusarium only. Option B Candida. Option C Aspergillus. Option D Mucor. The correct answer is option C Aspergillus. Let's go through the options. Fusarium only. Fusarium is a cause but not the only one. Candida. Candida in some settings. Mucor. Mucor is less common. And the correct answer is Aspergillus. Aspergillus is the commonest cause of a mycotic corneal ulcer. So, the right answer is option C. Aspergillus. Question 78. Angular conjunctivitis is treated with option A acyclovir. Option B steroids. Option C atropine. Option D zinc preparations. The correct answer is option D zinc preparations. Let's go through the options. Acyclovir. Not acyclovir. Steroids. Not steroids. Atropine. Not atropine. And the correct answer is zinc preparations. Angular conjunctivitis from moraxella responds to zinc preparations. So, the right answer is option D. Zinc preparations. Question 79. Cataract is characteristically associated with which muscle disease? Option A Duchenne dystrophy. Option B myasthenia gravis. Option C polymyositis. Option D myotonic dystrophy. The correct answer is option D, myotonic dystrophy. Let's go through the options. Duchenne dystrophy. Not Duchenne. Myasthenia gravis. Not myasthenia. Polymyositis. Not polymyositis. And the correct answer is myotonic dystrophy. Myotonic dystrophy is associated with cataract. So, the right answer is option D. Myotonic dystrophy. Question 80. Beta-naphthylamine exposure is linked to carcinoma of the option A, lung. Option B, urinary bladder. Option C, liver. Option D, stomach. The correct answer is option B, urinary bladder. Let's go through the options. Lung. Not the lung. Liver. Not the liver. Stomach. Not the stomach. And the correct answer is urinary bladder. Beta-naphthylamine causes carcinoma of the urinary bladder. So, the right answer is option B. Urinary bladder. Question 81. Condylomata acuminata are caused by option A, human papillomavirus. Option B, herpes simplex. Option C, treponema. Option D, chlamydia. The correct answer is option A, human papillomavirus. Let's go through the options. Herpes simplex. Herpes gives ulcers. Treponema. Treponema gives syphilis. Chlamydia. Chlamydia is different. And the correct answer is human papillomavirus. Human papillomavirus causes genital warts, condylomata acuminata. So, the right answer is option A. Human papillomavirus. Question 82. Verrucous carcinoma is associated with option A, radiation. Option B, alcohol. Option C, tobacco chewing. Option D, asbestos. The correct answer is option C, tobacco chewing. Let's go through the options. Radiation. Not radiation. Alcohol. Not alcohol. Asbestos. Not asbestos. And the correct answer is tobacco chewing. Verrucous carcinoma is associated with tobacco chewing. So, the right answer is option C. Tobacco chewing. Question 83. Familial adenomatous polyposis is a recognized precursor of option A, pancreatic carcinoma. Option B, gastric carcinoma. Option C, colonic carcinoma. Option D, hepatoma. The correct answer is option C, colonic carcinoma. Let's go through the options. Pancreatic carcinoma. Not pancreatic. Gastric carcinoma. Not gastric. Hepatoma. Not hepatoma. And the correct answer is colonic carcinoma. Familial adenomatous polyposis leads to colonic carcinoma. So, the right answer is option C. Colonic carcinoma. Question 84. Acanthosis nigricans is a recognized marker of option A, internal malignancy. Option B, starvation. Option C, anemia. Option D, renal failure. The correct answer is option A, internal malignancy. Let's go through the options. Starvation. Not starvation. Anemia. Not anemia. Renal failure. Not renal failure. And the correct answer is internal malignancy. Acanthosis nigricans can mark an internal malignancy or insulin resistance. So, the right answer is option A. Internal malignancy. Question 85. Dark field microscopy is used to diagnose. Option A. Syphilis. Option B. Tuberculosis. Option C. Malaria. Option D. Typhoid. The correct answer is option A. Syphilis. Let's go through the options. Tuberculosis. Tuberculosis uses Zea-Nielsen. Malaria. Malaria uses a blood film. Typhoid. Typhoid uses culture. And the correct answer is syphilis. Dark field microscopy diagnoses syphilis, the tryponema. So, the right answer is option A. Syphilis. Question 86. The incubation period of mumps is about. Option A. 14 to 21 days. Option B. 2 to 4 days. Option C. 30 to 40 days. Option D. 6 weeks. The correct answer is option A. 14 to 21 days. Let's go through the options. 2 to 4 days. 2 to 4 is too short. 30 to 40 days. 30 to 40 is too long. 6 weeks. 6 weeks is too long. And the correct answer is 14 to 21 days. The incubation is about 14 to 21 days. So, the right answer is option A. 14 to 21 days. Question 87. The commonest complication of mumps in children is option A. Orchitis. Option B. Aseptic meningitis. Option C. Pancreatitis. Option D. Deafness. The correct answer is option B. Aseptic meningitis. Let's go through the options. Orchitis. Orchitis is a postpubertal complication. Pancreatitis. Pancreatitis is less common. Deafness. Deafness is uncommon. And the correct answer is aseptic meningitis. Aseptic meningitis is the commonest complication of mumps in children. So, the right answer is option B. Aseptic meningitis. Question 88. Pharyngeal diphtheria is most common in the age group. Option A. 2 to 5 years. Option B. Under 6 months. Option C. 10 to 15 years. Option D. Adults. The correct answer is option A. 2 to 5 years. Let's go through the options. Under 6 months. Under 6 months is protected. 10 to 15 years. 10 to 15 is less common. Adults. Adults are less commonly affected. And the correct answer is 2 to 5 years. Pharyngeal diphtheria is commonest at 2 to 5 years. So, the right answer is option A. 2 to 5 years. Question 89. Legionnaire's disease is characterized by option A. Fecal-oral spread. Option B. Droplet spread. Option C. No person-to-person spread. Option D. Vector-borne spread. The correct answer is option C. No person-to-person spread. Let's go through the options. Fecal-oral spread. It is not fecal-oral. Droplet spread. It is not droplet person-to-person. Vector-borne spread. It is not vector-borne. And the correct answer is no person-to-person spread. Legionnaire's disease spreads from water aerosols with no person-to-person spread. So, the right answer is option C. No person-to-person spread. Question 90. Which is not a zoonotic infection? Option A. Dengue. Option B. Brucellosis. Option C. Rabies. Option D. Anthrax. The correct answer is option A. Dengue. Let's go through the options. Brucellosis. Brucellosis is zoonotic. Rabies. Rabies is zoonotic. Anthrax. Anthrax is zoonotic. And the correct answer is dengue. Dengue is mosquito-borne between humans, not a zoonosis, the exception. So, the right answer is option A. Dengue. Question 91. Scotopic vision depends mainly on option A. Ganglion cells. Option B. Cones. Option C. Bipolar cells. Option D. Rods. The correct answer is option D. Rods. Let's go through the options. Ganglion cells. Ganglion cells transmit signals. Cones. Cones are for day vision. Bipolar cells. Bipolar cells relay signals. And the correct answer is rods. Scotopic, night, vision depends on the rods. So, the right answer is option D. Rods. Question 92. The wave of the electroretinogram arises from the option A. Optic nerve. Option B. Cones. Option C. Rods. Option D. Pigment epithelium. The correct answer is option C. Rods. Let's go through the options. Optic nerve. Not the optic nerve. Cones. Not the cones alone. Pigment epithelium. Not the pigment epithelium. And the correct answer is rods. The wave arises from the photoreceptors, the rods. So, the right answer is option C. Rods. Question 93. The point of highest visual acuity is the option A. Fovea centralis. Option B. Optic disc. Option C. Peripheral retina. Option D. Ora serrata. The correct answer is option A. Fovea centralis. Let's go through the options. Optic disc. The optic disc is the blind spot. Peripheral retina. The peripheral retina has low acuity. Ora serrata. The ora serrata is the retinal edge. And the correct answer is fovea centralis. The fovea centralis has the highest visual acuity. So, the right answer is option A. Fovea centralis. Question 94. ED-mediated parasite elimination works chiefly through option A. Macrophages. Option B. Neutrophils. Option C. Complement only. Option D. Interleukin-5 and eosinophils. The correct answer is option D. Interleukin-5 and eosinophils. Let's go through the options. Macrophages. Not macrophages. Neutrophils. Not neutrophils. Complement only. Not complement alone. And the correct answer is interleukin-5 and eosinophils. ED works with interleukin-5 and eosinophils to kill parasites. So, the right answer is option D. interleukin-5 and eosinophils. Question 95. The optic disc is also known as the Option A. Blind spot. Option B. Macula. Option C. Fovea. Option D. Ora serrata. The correct answer is option A. Blind spot. Let's go through the options. Macula. The macula is central vision. Fovea. The fovea is peak acuity. Ora serrata. The ora serrata is the retinal edge. And the correct answer is blind spot. The optic disc is the blind spot. So, the right answer is option A. Blind spot. Question 96. The sensory supply of the eye is from which cranial nerve? Option A. Fifth. Option B. Second. Option C. Third. Option D. Seventh. The correct answer is option A. Fifth. Let's go through the options. Second. The second is vision. Third. The third is motor. Seventh. The seventh is facial. And the correct answer is fifth. The trigeminal fifth nerve gives the sensory supply of the eye. So, the right answer is option A. Fifth. Question 97. The vortex veins drain the Option A. Cornea. Option B. Retina. Option C. Optic nerve. Option D. Alveolar tract. The correct answer is option D. Alveolar tract. Let's go through the options. Cornea. Not the cornea. Retina. Not the retina directly. Optic nerve. Not the optic nerve. And the correct answer is the alveolar tract. The vortex veins drain the alveolar tract, the choroid. So, the right answer is option D. Alveolar tract. Question 98. The cricoid cartilage is described as Option A. A leaf-shaped cartilage. Option B. A U-shaped cartilage. Option C. A complete signet ring-shaped cartilage. Option D. A paired cartilage. The correct answer is option C. A complete signet ring-shaped cartilage. Let's go through the options. A leaf-shaped cartilage. Leaf-shaped describes the epiglottis. A U-shaped cartilage. U-shaped describes the tracheal rings. A paired cartilage. It is unpaired. And the correct answer is a complete signet ring-shaped cartilage. The cricoid is a complete signet ring-shaped cartilage. So, the right answer is option C. A complete signet ring-shaped cartilage. Question 99. Aldose reductase converts glucose to Option A. Lactate. Option B. Sorbitol. Option C. Pyruvate. Option D. Glycogen. The correct answer is option B. Sorbitol. Let's go through the options. Lactate. Not lactate. Pyruvate. Not pyruvate. Glycogen. Not glycogen. And the correct answer is sorbitol. Aldose reductase converts glucose to sorbitol. So, the right answer is option B. Sorbitol. Question 100. A gene is best defined as Option A. A protein. Option B. The part of DNA carrying genetic information. Option C. A chromosome. Option D. An enzyme. The correct answer is option B. The part of DNA carrying genetic information. Let's go through the options. A protein. A gene is not a protein. A chromosome. A gene is not a whole chromosome. An enzyme. A gene is not an enzyme. And the correct answer is the part of DNA carrying genetic information. A gene is the segment of DNA carrying genetic information. So, the right answer is option B. The part of DNA carrying genetic information.